and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Here we go.
Well, good morning, Anita.
Oh my goodness,
What
good
a
morning.
Wonderful
Now
morning.
I know why you have this
feel-
ponytail.
Yeah. Don't listen to...
Oh, yeah. Well, we have this great guy.
Don't
I
listen
wish he
to
had come in
Jasper.
before. Right. Jasper Rosario told me. You see, now the secret's
the
out.
secret of the ponytail.
Oh, we have to.
I just go in the morning and I twist, I turn clockwise until my face is nice and tight. And everybody say, but you stay so young.
Right.
That's it. It's in there. I have a...
Well, why don't you
Crank it up.
introduce this Jasper Rosario? who's a
Gasper
nurse
Rosario is a
practitioner?
nurse practitioner. He's a wonderful person, first of all. Gasper, welcome to the show.
Thank you very much, Andy and Anita. I really appreciate you
You're a
having
virgin,
me here.
you know.
You're breaking it today.
breaking
I'm
you
breaking my
in.
cherry, yes.
So you have a very shining, beautiful face. It looks like a baby's face,
Oh, you
actually. It's
saw-
amazing. Look at it. It's,
Thank you so
So
And
much.
he
never
doesn't
seen-
have a ponytail, so we have to know
yeah.
his secret.
So what's the secret?
Well, men, when we shave, we exfoliate. So that's part of the reason why our face, my face is, nice and shiny.
Yeah,
and
but you don't
clean.
shave. Do you shave up on your forehead?
I shave because I'm bald. I shave my forehead, and I have, I grow
You're
hair
not bald.
everywhere else.
You're not bald. You just don't have a lot of hair on top.
I don't have a lot of hair on top, but I'm going to have Dr. Mencia provide me with one of those PRP treatments, and I'm gonna grow a jerry curl.
This is just getting wild. For people who've been listening to Dr. Mencia, we've been talking about heart failure and stroke, and but now we're getting, especially since your name in your new office is AGI,
AGI.
which we need to talk to people.
I love that name.
That's right. It's really Adult Geriatric Institute, but it's a nice short name, and
It's a nice short name.
it's AGI Medical
AGI.
and Dental Centers.
And then you can say, now, I'm going to AGI to get my vampire facelift.
That's a nice ring to
Now, let
that.
me ask you a question. This vampire facelift, where did that get started? Can you tell me that, Casper?
Absolutely, sure. There's a Dr. Charles Runnels from Louisiana. They've been using Platlit Rich Plasma in medicine for a long time, harvesting the growth factors and fibrinogen and all the fabulous healing potential of the blood. And Dr. Runnels, he trademarked this name, vampire, because we're using your blood. And the vampire treatments, the vampire facelift, the vampire facial, there's a vampire breast lift.
Oh, really?
There's a
There's a
I
ponytail
There's
term.
Yeah. One
the,
for
it,
the
it even
Vampire
gets a little
breast
more
lift.
invasive. There's the O shot. It's the orgasm shot that you inject the platelet rich plasma into that tissue, the vaginal tissue, and there's a priapus shot, and that helps different erectile dysfunction, urinary incontinence. So this is a huge development in the
So
treatment.
there's some medical use there for
Absolutely.
this. Okay.
Absolutely.
Okay. I'm so much into nature, Gasper, and when I first heard about this, I started googling and going to YouTube and looking at this thing. I say, this is wonderful. This is as natural as you can get, because it's taking your own blood. Then you have to centrifuge that blood, because tell me the process. You have to get rid of the rest of the blood.
Right. The process is we'll draw blood the same way we do when we're having our routine blood work. And there are special tubes, a special machine that will spin the blood and separate the red blood cells from the plasma, the yellow gooey part. And in that part of the makeup of the blood, there are growth factors and stem cells that then we could harvest that and use its healing factors, and we re-inject it into the tissues that we want to treat. And what basically we're tricking the body into believing it had an injury, so it starts regenerating those
They
tissues.
start generating.
And it's your own blood; it's natural, and it
And so
doesn't get
people
any more than that.
understand what that machine is doing is it's like a centrifuge, very high velocity. So a centrifuge usually take any product that you put in there, and it separate by weight. So the heavier uh, particle will go to the bottom, and the lighter one will stay on top. So if you look at the different type of blood and that we have, red blood cell, white blood cell, and those particles that Gaspar is talking about, the red blood cell, the white blood cell, all the heavy protein and cell go to the bottom, and then on the surface you have this platelet and all of this product that you can use to make the collagen in your body start activating and regenerating.
Actually, there's a doctor that I know has been doing a lot of stem cell work. He asked me to come in and watch this procedure. And I saw just what you're talking about with the centrifuge, and they were injecting in their back different things. So this is really coming now even more into the public, isn't
Into
it?
aesthetic now. It's being used into
Absolutely,
aesthetic.
that's what started in
Fabulous.
orthopedics. They would inject the PRP in between the joints.
PRP. That's
Mhm.
right. That's what I've heard. That's right. PRP. Well,
And
this
PRP
is
is
wonderful.
PRP is what the
Platelet rich plasma.
plasma.
Yes.
Wow.
Platelet.
So now you're. I really hope you do get into this, Dr. Mencia. I
We
think this
got
is
into
the
it. Now
anti-aging.
that we got Gaspar coming in.
This is really anti-aging
Yes.
medicine.
And Jasper Rosario, he's a nurse practitioner, and he is licensed. Correct me if I'm wrong. He's licensed in New York,
I'm licensed in
Florida.
New York, New Jersey, and Florida.
more than me. I only have, I only
Watch
have,
out.
I only have the big boys, New York and Florida.
This is very exciting stuff. I'm so glad, Dr. Mencia, that you found Gasper and that you're going to be having him as a consultant.
Yes, he's going to be able to do, and he does a lot more than the facelift. I mean, that's the latest thing, and he came by, and we did a nurse together. And oh my God, and she's on Facebook with me, and I watch her. I see because she's posting picture of herself, and I'm looking at her vampire face. We did a facelift and the facial on her
Yes.
at the same time. So I keep watching her on Facebook, and I say, wow, she's really looking great. She keep, so
Well,
Yes.
well, can you tell me the procedure? Let's say Dr. Mencia has a patient, and he looks at her and he feels she's in good health, but that she wants some work done. What would happen? Just walk us through this.
So what we're looking at is a couple of different things. We're looking at the texture, the color. We're looking to see how we can treat the patient. If the patient is younger, doesn't have a lot of volume loss, from the face, then probably an appropriate treatment would be the facial. The vampire facial, the vampire facelift is.
So go back to the facial. What is a vampire
okay, so
facial?
the vampire facial is we're harvesting the platelet rich plasma.
Well, where are you going to get that from?
We're drawing
the
it from the
patient.
patient's own blood. We draw it from the arm, just as if we were doing blood work or routine blood work. And we'll put that blood in a special tube and a special system that will centrifuge and spin the blood out, like Dr. Mencia just explained in detail. And then we're going to draw that. Excuse me for the pause.
Oh, we
We're
always
going
pause
to-
here.
Thank you. We're going to take the blood out of the PRP out of the tube, and we're going to activate it with calcium chloride. This is a special process. This is how you trigger the growth factors and from the blood. If you just inject the blood into the tissue, it's not going to create the fibrinogen and elastin and all these growth factors. So we have to add calcium chloride to the platelet-rich plasma. And then if for the facial, we're going to use that blood as a serum. We're going to apply it topically. And with a little device called the microneedling device, it's a stamper. It's like a reciprocating, a little machine that pushes the needles up and down. They're tiny needles that are like acupuncture size, 31 gauge. So
Makes
they're
me think of
very fine.
microderm, like
It's a
a
Yes.
micro needling. It's very similar to that, and it'll stamp the skin, and it's very gentle. It's not painful at all. We could apply a topical cream on the face to just to add a little more comfort to the procedure, and then with the serum, the blood as serum, and the machine. Sorry for all these ums. We're going to microneedle the PRP into the skin through the epidermis. So we're doing tiny, small injuries to the surface of the skin, and the PRP is going to be pushed into the epidermis of the skin and into the layers. And that what that'll do is that'll build collagen. It'll stimulate collagen growth. It'll build angiogenesis, is the new formation of blood cells, blood vessels, and it'll give color and texture will improve.
Well, that's wonderful, and I really appreciate your doing the description. Something everyone knows on our radio show, this is all free flow.
Exactly.
Dr.
Yeah.
Mencia and I don't plan this, but he always winds up having guests who just are so articulate. This was great, but Dr. Mencia, it's something that you said before. Remember we were talking about dental, and the thing that is so important about the AGI medical and dental centers is that you are there to make sure nothing goes wrong, because even though that's a that's a procedure,
Right. Exactly.
and if they're doing this in certain places without that MD, as much as a nurse practitioner is great,
Exactly.
that's what I love about what you do. So when Jasper Rosario comes there, you're there.
Exactly. He becomes just another member of the team. So the entire team is there. The plastic surgeon is available. The dermatologist is available. Jasper Rosario is there. I'm there. The dentist is there. It's like a whole team. So when a patient comes for something medical or for something aesthetic, a person that is losing hair, I want to have the procedure for hair loss, and we can talk a little bit about that. Or they just want to rejuvenate their face. They want to take 10, 20 years off their face. All of that can be done. And it's interesting, Gasper, because the procedure, the result is almost instantly.
The result is almost instantly with the vampire facelift, because we're also, aside from using the blood, we're also using a hyaluronic acid filler in conjunction with the blood, with the PRP, and you get to see the results immediately. And then over time, a course of 4 to 8 weeks, then you'll even see more improvement as the body is regenerating.
Exactly.
You know,
Oh, I see. So it's going to get better even than when you first see it.
Absolutely. At the beginning, you only see the tip of the iceberg because it's just the injury that had been produced at that moment and the volume that you had just received at that moment. But then now the body start recognizing and say, hey, these are my own platelets that had been injected on me. And those platelets, I was having a talk with my plastic surgeon who had done some research way back when, before PRP was well known. And he was telling me when you add the calcium to the platelet, how the platelets start branching. And you can look at this under the microscope. And it was like immediately when the calcium is added to the platelet starts sending little feet all over and branch out in all directions, three-dimensionally, start branching out. So when those platelets go in your face, they start branching out, and then the collagen cells start producing more and more collagen. And, when we look at wrinkles, you have to see wrinkle as basically part of the dehydration and injury that the skin have suffered. That's what wrinkles are. So when you get this platelet, you rehydrate your skin, and you fill up those empty spots, and you go back to having a baby butt.
A baby butt. He has the greatest words here. But this is, how old is this, Dr. Mencia? How long have people been doing this? 10 years?
they've been doing this in orthopedics for over 20 years, the Platlit Rich Plasma. The Platlit Rich Plasma has been used in orthopedics for about 20 years. This is new in the medical aesthetics field. But, as we learn more and more how to manipulate these cells, where the, is endless. The treatment possibilities with
It
this.
sounds wonderful. One thing, Dr. Mencia, I think we ought to take a minute, though, to talk about your fantastic new center, which is in Boynton Beach.
I'm going to go there this afternoon to check out how
It
the
is
development
incredible. So if people want to know, I know you've been traveling down to Commercial Boulevard to see Dr. Mencia, but his practice has just gone so wild. It's so crazy. He needed to move up to Palm Beach County, and he found a fantastic center, a public center, which is off Hagen Ranch Road, about 2 miles from south of Boynton Beach Boulevard. And it's going to be a gorgeous medical and dental center. They now have named their center AGI for short, but it's the Adult Geriatric Center. But let me just tell you that everything's going to be done there. They're trained, they're highly trained specialists that you know. Dr. Mencia has brought them on the show. Let me give you some phone numbers. Why don't we give you the phone number in commercial so that you can call there, and then you'll be able to make appointments. The number there is 954-489-1345. 954-489-1345, and they're going to be open probably in a week there in Boynton Beach. But they'll let you know. Just call their Fort Lauderdale office.
But the phone is active already in Boynton.
Oh, it
They
is?
can call the Boynton
Okay.
phone number.
Okay, I'm going to give that. Now we're going to give two numbers.
So for the people from West Palm Beach and say, I don't want to call Broward, I'd rather call. There you go. You can call locally.
Okay, so the one in Palm Beach County is 561-270-6494. Get your pencils out. You know this is Pencil Talk Radio. We've been doing this for 20-some-odd years. Get your book out. Write all these numbers down. This is the AGI Medical and Dental Centers of the Palm Beach County. Numbers 561-270-6494. And always you can call. In fact, it's open Saturdays in Fort Lauderdale. That's 954-489-1345. I want to come down and get my flu shot, but I don't know. Is it just because I got over my cold? Is it too soon?
You're ready. No.
Am I okay
you're
to
ready.
do that?
You're good.
I have to do that. We haven't talked about flu shots. Very important.
Very important. Well, we started mentioning last month,
Yeah.
letting people know before the snowbirds start coming.
Jasper, get your
Before
flu
Jasper
shot.
come with all his people from up north.
Right.
You know?
I got my flu shot already.
You already got his flu shot.
So-
But Dr. Mencia, this is a very exciting new possibility for you. You're going to have a very special spa area there. We're going to
Right.
have a cookie cafe
Cookie cafe we're going to have.
with Smart for Life. That's right,
Right.
Cookie cafe.
So
And you
people
can
don't
have
want to
your-
go on a diet.
Oh, right.
Right.
And it's a delicious way to
Because,
do
you
that.
know, if you're going to see Jasper to get your treatment, then you can get your diet, get your treatment. You know, you look beautiful and you keep looking beautiful. Jasper, if people want to come and get a consultation, basically you would do that free of charge.
Absolutely, the consultation's free of charge, and tying weight loss into this process. This is how I got into the aesthetics.
Oh.
My primary specialty is bariatric surgery.
Oh, my gosh.
Oh, wow.
See, you didn't even know.
I work at NYU in the bariatric program there, and patients were losing a lot of weight, and they were getting older by the pound. Some
Right.
patients were like, I got to stop losing weight. You know, I look older, because when you're heavier, your face is full, you're plump.
Right.
So then I said, wow, let me see, what do I do to treat these patients that I want them to continue to lose weight? And that's how I got into the aesthetics.
Oh.
So wait,
So-
is the platelets going to puff up their face?
So,
Really?
So it's creating volume by building the collagen. So that's how it's helping. And aside from the PRP, you know, we do Botox and hyaluronic acid fillers, different Voluma. I don't want to give any product a name, but hyaluronic acid gives volume, and the neurotoxins will help numb the muscles or decrease its activity to help with the wrinkles.
Okay, the big one is when you first started talking. What's this breast uplift? I want to know about
Yes,
that.
let's talk about that.
Let's
Let me see if I need that stuff.
Yeah, we want to know about
So-
breast uplift.
So the vampire breast lift. That Dr. Charles Reynolds, he trademarked these procedures, and what he did was he was able to take that same process, harvest the blood, PRP, activate the PRP as if we were doing the facial or the vampire facelift, and he injected it into the cleavage of the breast, the inner aspect, and it will give a little more volume to the breast tissue on the cleavage area.
I usually use hyaluronic acid to fill it up, so now you can do also with the PRP.
Exactly. So the hyaluronic acid with the PRP will give it maximum benefit because you get the lift action from the hyaluronic acid. It acts like a scaffold, and then the PRP, once the collagen starts building, it'll give an additional volume lift.
Excellent.
And so what I want everybody to know is that you are listening to Jasper. We have
Jasper Rosario.
right, Jasper Rosario, and you can reach him for an appointment by calling Dr. Mencia's office.
It's going to be at either office. He's going to be able to see
right.
patients. You just have to set up an appointment for a free consultation with him. Or if you are interested in getting the procedure for hair loss or any of the procedure that
Wait. What do you mean hair loss? We've never talked about this.
for hair loss, you can also have the procedure if you're losing hair.
Why? Is he going to do the same thing?
So the amazing power of blood and its natural ability to
It's your
heal
own
and
ingredients.
it's amazing. I did you do these courses and you learn about these procedures, and you say, okay, I see pictures. Does it really work? Right? We know the science is there. It works theoretically. So I said, I'm going to do this on my mom, and her hair's been thinning. I don't know. She's probably 20 years. So on Mother's Day, she wanted me to do this treatment on her. So I did the treatment on her. And I'm going to show you. You can't see the picture on the radio, but it's amazing.
Oh, my listeners can see the picture on the radio because we describe it.
It's amazing because. So that's why I was joking earlier that I'm going to have Dr. Mencia help me grow a Jerry curl. Because it really
A
grows.
Jerry curl. Let's see. Okay, this is one of the this is from your
So
picture.
This is.
Yeah, it's the picture he has.
Did you show her the
Yeah.
before?
Yes.
So it's amazing. I mean,
And how?
It really-
And you're telling me you do it's to do with
No,
platelets
that's a
the same
man or
thing?
this is my mom.
That's your mom?
Yes.
Oh, wow.
My mom is going to be upset that you said that, but it's not your fault.
Wow,
You
that's-
can't see. You've
no,
seen the
that's,
top of the
that's a
scalp.
big that's a big change.
That's a dramatic change.
That's a dramatic change.
And how
And-
long did it take?
Incredible.
So I performed the
Jasper?
treatment on May 10th on Mother's Day, and that picture was just before me taking this flight down here. So it's growing. It's only 4 months.
And only one time. You don't have to repeat it?
I did the treatment one time for her. Women can usually be treated with one treatment. Men require 2 treatments because men, we have the DHT, the dihydroxytestosterone that helps affect negatively for us the hair follicle. So with the DHT, that requires us men to have 2 treatments.
Mm-hmm.
You know, I'm getting very excited about this. Usually you've shared a lot of things with me, but this is really amazing, Dr. Mencia.
We have to
You
bring
are going to
Jasper
probably
again.
have to have a salon part of this. I
Right.
can see this could be a major part
So
of
you
your
can
practice.
do lips, you can do the Botox, you can do the mesotherapy, you can do basically all aesthetic.
I do all those treatments, Botox, fillers. I love the effect it has
I
on the
love the
patient. I mean, look at
aesthetic.
this.
Look at that
Look at this picture. 68-year-old female. This is some hyaluronic acid and some Botox. I mean,
Oh, you mean the one on the right is the new one?
This after the before
Yeah,
and after.
I see this.
You know,
Beautiful.
This
Yeah.
is absolutely amazing for
Yeah.
everybody. It's like a baby. What'd you call it? Baby
Baby's
butt?
butt,
Baby
yes.
butt.
Looks like baby butt.
Yes.
And we have. Do you know what? Maybe that's the name of this.
Yeah.
Go have a baby butt.
Well,
treatment.
they know my secret about the ponytail.
Yeah, right,
We have
with
to
the
find. We have
ponytail.
we have to bring Jasper back because we have to find out his secret. He looks good.
Now this
Thank
is amazing. This is absolutely amazing. You're right.
That's a lip augmentation. This young lady,
Wow.
Her lips were very thin, and
I want
you
lips
know,
like those.
No, we don't want your lips like those. Your lips are gorgeous. Stop it.
So the treatment, it's
Very
unlimited
beautiful.
possibilities.
Beautiful.
With what we can do.
You're the real thing.
You are an
Thank
artist,
you.
yeah.
And I'm an artist. I
Yeah,
sculpt.
exactly.
This
You
is-
know,
Oh,
This is
so he's a
art.
sculptor
Yeah.
too. We don't know much about him.
we have to bring
Oh,
him back.
we're going to
I
have
have to
to
come
bring
back.
him.
Back, yeah.
He's got to come to your opening.
Absolutely.
We have to do that. Are you going to be down here a lot now?
With God's grace, I plan to come down once a month to start. And
Where does
then,
your mother live?
In New York City.
Too bad. If she
Yeah,
lived
we
here,
have to
you'd be
move
here
it.
more.
You'll be here more.
Bring your mother down.
Let's see if we could bring her down here.
I want to give the phone numbers again because we need you to call for an appointment. If you're going to, of course, you want to see Dr. Mencia today. They're open Saturdays, and that's in Fort Lauderdale. That's 954-489-1345. But just write this number down. Probably in a week or so, you're going to be able to go to AGI Medical and Dental Centers in Boynton Beach, 561-270-6494.
And you need to call in because, it's going to be limited. We're going to have a open house. It's going to be a major open house. It's going to be October 23rd. And if the day change, it's going to be between 3:30 to 7 o'clock, October 23rd. I think that's a Thursday.
Okay, October 23rd between...
It's going to be the big open house.
You said between 3 and 7.
Between 3:30 and 7 around there.
Okay, because
3:30,
I'm going to
4
put that
o'clock.
in the seminar page, events.
Okay.
So I'm
excellent.
holding you to this.
Yes, you're right.
Okay.
Exactly.
So you want to mark that down for your
Absolutely.
schedule.
I have that marked down already.
So you can meet Jasper Rosario there, Dr. Gonzalez, the vascular surgeon. That
Dr.
does the
Andy
vein,
Mencia,
Andy Mencia,
Dr. Rosemary
Dr.
Mencia.
Moskowitz, Dr. Joseph, everybody. All the specialists.
The dream team.
Dr. Gupta, the
The
dream
dream
team. Yeah, I like
team.
that one. Let's change
Baby
the ad now.
Butt, the dream team. I like Baby Butt better, but that's okay. I know, I'm looking at some fantastic
That's a
pictures.
vampire.
Well, I think what we have to do then is be
have
able
to
to
bring him
put
back.
something back on there. Well, we're going to go to a fast break. Thank you very much for coming on, and we will be back very soon.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.